Hello, my name is Gaurav, and today I'll be presenting on multiple sclerosis, focusing on the case of Daniela, a 32-year-old woman of Irish background. Daniela presented to the emergency department with blurred vision in her right eye, unsteady gait, increasing fatigue, mild urinary urgency, and tingling in her left hand. With a family history of MS, her father was also diagnosed. Neurological investigations have confirmed her diagnosis. In this presentation, I will explore the epidemiology of MS in Australia, the pathophysiology and pharmacology relevant to Daniela, and an evidence-based nursing care plan for her acute presentation. Epidemiology in Australia. Multiple sclerosis is a chronic immune-mediated demyelinating disease of the CNS. In Australia, MS affects 33,000 people, with three-quarters being women, and is more prevalent in people of Northern European descent, like Daniela. The highest incidence is seen in southern states, correlating with lower sunlight exposure and potential vitamin D deficiency. Diagnosis commonly occurs between ages 20 to 40, making Daniela's case typical in age and gender profile. From a nursing perspective, this epidemiology means nurses will frequently encounter young, otherwise healthy women facing life altering diagnosis, and culturally tailored education and psychosocial support are essential. These are two graphs and charts showing MS cases nationally and MS cases over the years. Pathophysiology. MS involves autoimmune mediated destruction of myelin in the central nervous system. In Daniela's case, her blurred vision is due to optic neuritis, where inflammation disrupts nerve signal conduction in the optic nerve. Her unsteady gait and left hand tingling indicate lesions in the cerebellum and sensory pathways. The disease process begins when activated T cells cross the blood brain barrier and target myelin sheaths, leading to inflammation, demyelination, and eventual axonal damage. This disrupts salutary conduction along neurons, resulting in slowed or blocked nerve transmission. Over time, myelin loss and neurodegeneration produce both reversible relapses and irreversible disability. Pharmacology of methylprednisolone. One of the most common medications for acute MS exacerbations is methylprednisolone, a corticosteroid. It suppresses immune system activity, reducing inflammation and edema in demyelinated areas. Indicated for short-term use to hasten recovery from acute relapses in MS. Nursing considerations include monitoring BGL, mood changes, gastrointestinal upset, and infection risk. Include administer in the morning to reduce insomnia. Ensure tapering if used beyond a few days to prevent adrenal suppression. These two charts show how methylprednisolone works in MS and how methylprednisolone is administered. Acute care nursing plan. In Daniela's acute presentation, the most urgent nursing issue is impaired physical ability related to cerebellar involvement and unsteady gait. The goal here for Daniela will be to mobilize safely with minimal assistance, reducing a fall risk during hospitalization. Interventions include implement fall preventions strategies, collaborate with physiotherapy or physiotherapists to educate Daniela on energy conservation techniques. These interventions are supported by evidence showing that multidisciplinary care and patient education significantly reduce fall rates. This has been put into a acute issue, goal, and intervention table, like aforementioned. Health promotion. Evidence from Australian MS cohorts links social connectedness and multidisciplinary support with better well-being. For Daniela, practical home safety, fatigue self-management, and screening/treatment for mood symptoms are core to sustaining her work and independence. In conclusion, Daniela's presentation illustrates the complex interplay between autoimmune destruction in MS and the resulting neurological deficits. Early targeted nursing interventions combined with pharmacological management are critical to improving patient outcomes. By understanding the epidemiology, pathophysiology, and evidence based nursing care strategies, we can provide holistic, safe, and effective care for patients like Daniela. Here I've got references that I've used throughout the presentation, and they have been organized in alphabetical order. Thanks for listening.